Good evening. I'd like to call the Douglas School Committee to order at 7:01 on February 23rd. I'd like to briefly go into the Douglas Creed that we have. The Douglas Public Schools offers diverse learning experiences that meet the academic, social, and physical and emotional needs of all the students. We provide a supportive and challenging learning environment in which students may achieve academic achievements, academic success, and personal growth. Decisions are made in the best interest of students. I'd like to do a call to order and do a roll call vote for the school committee members that are present via Zoom.
Lisa Brown, aye.
Becky Cherniak, present.
Heather Morin, present. I don't think Julie's on, and I know Monique.
Yeah, I am.
Oh, hi, Julie. Sorry.
Oh.
So Julie's here too, so we have enough for our quorum. We're going to do skip the Pledge of Allegiance, and I don't believe we don't have a student representative, so we're going to go into public comment. If anyone would like to enter into public comment for us to discuss, we're doing about the mask policy revision. You're limited to 5 minutes to come before the board. Please raise your hand. 3 minutes, sorry. 3 minutes, please come before the board and by raising your hand, and Dr. Vera will let you, will select the persons to go.
If you could raise your hand virtually, that would be helpful since we have multiple screens here. Just gonna... I do not see any virtual hands raised at this time.
So if no one has anything else for public comment.
Oh, we do have one hand. We do have one hand that just went up. Travis Brown.
Yes, hi. Just for the record, my name's Travis Brown. Have two daughters in the public school system. I just want to say I know everyone here probably has a strong opinion on this matter, the mask mandate. We just hope that the school committee follows the guidance of DESE and Dr. Vieira, as they have consistently done throughout this pandemic. Thank you.
Mr. Brown, can you please state your address for us, please, for the record?
Yes, 28 Wallace Street.
Thank you so much.
Thank you.
Thank you. Let me just do another quick scroll. I do not see any other hands up.
Anyone else for public comment before we close?
Erica Brown just has her hand up.
Erica, before we start, can you please state where you live too in Douglas? Thank you so much.
Sure. Erica Brown, 28 Wallace Street. I just sincerely ask that the school committee uphold Superintendent Dr. Vieira's recommendation to remove the mask mandate and follow the state's guidance. Thank you.
Thank you.
Ryan Shepard.
Hi, how are you? Ryan Shepard, 82 Northwest Main Street, Douglas, Mass. I have 2 children currently enrolled in Douglas Public Schools, and I have 2 upcoming in the future. I would like to just piggyback off what the previous 2 had said, just to go along with the recommendations of those mentioned.
Thank you so much, Mr. Shepard.
Thank you.
Anyone else with public comment?
Brian Bergeron has a live hand.
That works. Yeah, Brian Bergeron, 64 Wallace Street. I'm just hoping that if there is a decision to maintain the mandates, that there was sufficient evidence to support that, because I know that there is evidence going in the way of removing those mandates, and so it seems to me that to switch to deny the optional masking would also have adequate evidence. That's it.
Thank you so much, Mr. Bergeron.
It just says iPhone with a hand up. I'm sorry your name's not on there. So I see your hand raised. If you could just state your name and your address. You're still muted.
Sorry. Diana Grandy, 58 Birch Street in Douglas. And I'd like to have my opinion of making masks optional for the school.
Thank you so much.
Thanks.
Anyone else? Seeing that there aren't any more, I'm going to close the public comment section and go right into some new business. And we're going to do the superintendent's report, please, with Dr. Vera.
Hello, everyone. Hope everyone's having a great vacation. Only in Massachusetts do we go from 70 degrees today to a snowstorm in 2 days. So I'm going to dive right into the mask mandate piece and incorporate that as part of my COVID report. As people are aware, Commissioner Riley and Governor Baker announced that the mask mandate in public schools will be lifted effective Monday, February 28th. Commissioner Riley stated that after he made this decision after consulting with medical experts and state health officials. Both the commissioner and the governor cited the Commonwealth's high vaccination rates and the widespread availability of the COVID-19 testing for both school personnel and students to help support their decision. They both went on to state that masking is an option for those who continue to wear masks, and they emphasize the importance of those who face a higher risk from COVID-19 to be able to continue to wear masks. DESE and the Department of Public Health continue to strongly recommend that unvaccinated individuals continue to wear masks in school. Commissioner stated and will do the same, that the department will continue to monitor health data, consult with medical experts and state officials, and issue further guidance and or requirements as needed. Governor Baker reiterated the importance of vaccinations and testing as two strategies that will assist us in keeping our schools safe and open. The governor also reiterated the importance of his desire, and I think all of our desire after 2 years, to return to some sense of normalcy in the classrooms. And having kids and adults have the option to not wear masks is definitely an outward sign of that normalcy inside classrooms. Last week, principals met with staff, and staff met in turn with students to begin to review and discuss and prepare them for the transition should the school committee vote to go mask optional effective February 28th. We'll be spending time in homeroom and morning meetings and advisory with students to prepare them for this transition. And again, the most important thing is we want people to feel safe and supported, and we want this transition to be smooth for everyone. Want to really emphasize the importance that if we do go mask optional, that there will be zero tolerance for any individual who bullies or gives a hard time or makes fun of or picks on any individual who does decide or choose to wear a mask in school. People have their personal beliefs, people have medical conditions, people have their own set of values, and we want to support those individuals who would so choose to wear a mask in school should they decide to. So with all that evidence and all the information in front of us that's been here for the past 2 weeks, my recommendation to the school committee is to, effective February 28th, have the Douglas Public Schools be mask optional for anyone who chooses to do so. So that's my brief presentation. I think I've sent out a number of advisories in the past 2 weeks highlighting what the commissioner has said, what the governor has said. There's been some surveys out there. The majority of the school districts, with the exception of the big inner city schools, Worcester, Boston, Everett, Chelsea, they're still going to mask, but the other schools are all going mask optional, effective sometime late February, early March. So this would be consistent with what's being done in the Valley and across the Commonwealth. With that said, I'll open it up to questions or comments from the committee at this time.
Anyone from the committee have any comments or questions for Dr. Vera? No, I think
I just have, oh, sorry.
Go ahead, Julie.
So I don't really think that, since this whole pandemic thing took place, I never wanted to play doctor for anybody in the school. I don't have a PhD, so, but I also don't go by what like the flavor of the day is or anything like that. And I just think it's kind of strange that we were doing N95 masks like a few weeks ago, and then all of a sudden it's going to go like nothing. I also think that parents have the right to, you know, if they don't want their kids to wear a mask going forward, I get it. And I understand people's concerns. So I'm not here to, again, to play doctor and to act like I'm like some, you know, medical person. But if we go by how we've been going by, like I'm looking at this article right here that I just printed off the web, and it's like, well, there's this new variant coming out and it's vaccine resistant and antibodies don't work against it. And I think, I don't know, I'm very, I guess, nervous about what's going to happen, because I don't feel like masks save lives, but I feel like masks also have saved lives, actually. So going off of like what the opinion is in Massachusetts, I know other states right now, they don't have mask mandates. You go to other parts of the countries, they don't have it. And I think my biggest concern is the mask shaming, and understanding that there are people out there that are really not comfortable right now. And I think that's where I'm just trying to head. There are people that are not comfortable. And I think I just want to reiterate that it's just not right to mask shame people, because, you know, things just keep changing. And I personally have been very nervous about this meeting, but I also understand everybody's feelings and I respect them. So that's all I just wanted to say.
Thank you, Julie. Anybody else?
I just have one thing. Will the kids be getting off the bus and right into homeroom to be discussing this on Monday?
I know some of the principals have already had the discussion, and I know in the elementary schools, they start with morning meeting. I know Josh has done something with kids. I can find out if they're going to roll right into this on Monday, but that's a good idea to at least talk to the principals to have kids go into morning meeting or homeroom to have the discussion.
I wanted to add to Paul that if we do vote to not have masks, I know it's still a federal mandate that kids have to wear the masks on the bus. So that's something that we really can't lose in like understanding any decision that's made tonight. And also there needs to be some procedure in place for, especially I think the little kids, that if they have to wear it on the bus and then get off, like where are they putting that in their backpack? Where are they storing it and then returning it so that they have it at the end of the day for when they go back on the bus.
So there's actually two places. They have to wear them on the buses and they have to wear them in the health office. Those are the two places mandated that students have to wear masks. I know Mrs. Keegan has been in touch with Telstone, and we're going to be making sure that the bus drivers have additional masks in case kids don't have them. As we watch the pandemic, we remember that back when this first started, it was impossible to get hand sanitizer and masks. Now there's an overabundance of them. Back in November, December, you couldn't find a test kit. Now we have test kits everywhere. So we have enough masks that we can provide them to the buses to make sure that when kids are getting on and off the bus, that they have a mask with them. Mrs. Keegan, do you want to talk a little bit about your conversations with Telstone?
Oh, yeah. Thank you very much. Yes, I did already provide adult size and child size masks for those students that do get on the bus without them. We don't have, because really what I was handing out to them and really want to hand out to them is the surgical mask. And we don't have an unlimited supply of those. We have a lot of the cloth masks, but, we are hoping that, a lot of parents will send their students on the bus with a mask. But if they don't, we do have them available on all buses.
Thank you, Mrs. Keegan. I guess just to reiterate, I just want to make sure parents understand that even if we do optional go with mask optional, you still have to, for the buses, have a face mask, as well as in the health office for the nurses. That's nothing that that's out of our foresight to be able to tell people that no, they can't. If you want to get your child on the bus, you have to wear a mask. So I just want to make sure that that's very clear, because I don't want to have you guys inundated on Monday morning because a child was turned away at the bus saying. So that's just my biggest fear right now, I think, is Monday. We may be doing some juggling around. So if we could possibly send out, based on how tonight's vote goes, a reminder to parents, I think that's imperative, that we need to do that to remind them for the bus transportation as well as for the nurses' offices that they're required a face mask. Does anyone else have any other comments from the school committee?
I do have a question. Paul, do you happen to have current data on our vaccination rates in the schools?
Sure. So this was as of February 4th. I'll give you two different numbers. One is for our 5 to 11-year-olds. We have 28% of kids in that age, in that range, with one dose, and 21% who are fully vaccinated. In the 12 to 15 range, we have 62% of the kids with one dose and 53 with fully vaccinated. And in the 16 to 19 age bracket, we have 79% of the population with one dose and 71% fully vaccinated. Now, one thing to keep in mind with those numbers is that includes all Douglas residents ages 12 to 15, regardless of if they go to our schools or not. So we had the nurses pull up some numbers, and this is fairly accurate. In the primary school, that breaks down to 39 kids who are fully vaccinated. At the elementary school, breaks down to 132 students who are fully vaccinated. At the middle school, 159 kids, and at the high school, 202 students. About 2 months ago, we did a survey of staff. Out of our approximately 225 staff members, we had 164 respond. And out of those 164 people that responded to the voluntary survey, 88.4% of those were fully vaccinated. So we are looking at the numbers. I've been tracking the fully vaccination rates since the start of the school year, and I do it once a month, and it goes up about 1 or 2 percentage points every 4 to 6 weeks. So it's really not, it's not jumping up, but it is going up 1 or 2 points every week.
Okay, I appreciate it. I think if we're looking at vaccination rates as a mitigating factor, then we need to actually think about what they are.
Mm-hmm. And we've offered 2 vaccination clinics within the school district. We had one in November and December. We just finished our second one last week. First one, we had great attendance. We had about 135 people attend. Our second one, the numbers were down a little bit. But if we have to do it again in another couple of weeks in order to get people that next round, we'll do it. And that was vaccination, first shot, second shot, and booster.
I wanted to ask a question actually now. So I know I mentioned this a little while ago, but I'm just curious, and I understand if you can't share it, but since the school year, this school year, and even if you want to compare last school year too, for Douglas kids, like how many kids have actually been hospitalized due to COVID, and how many kids have actually gotten like really, really sick? Do we have any of that information?
I don't have the hospitalization rates of students.
I mean, have we had any kids pass away from COVID in Douglas in our school system?
We have not.
Since 2020?
We have not.
That's good, actually.
I just have one more thing. Sports, after school sports, this would not affect any MIAA anything because they haven't come out with their decision.
They have. The MIA came out about 2-3 days after the commissioner did, and they've lifted the mask mandate for all student athletes. However, if we go to a school that still has a mask mandate in effect, we have to abide by the local decision. So if we're traveling to Worcester to play the Worcester Public Schools and they have a mask mandate in effect, then we will have to wear a mask there. But they've lifted the mask mandate. And if you so choose to lift the mandate, then our student athletes would not have to wear masks during practices or games.
Will we be voting now, or do we need to enter the consent agenda?
We can end my report and then go, if there aren't any questions, and just go down to the consent agenda. The Nichols College piece I'll save for the, in our partnerships with that, I'll save for our next meeting a week from today.
Okay. Okay. I mean, I think I would just add my 2 cents more. I just want to clarify that, you know, asking about the vaccination rates, I just think that it's important for people to be informed. I think it's important for parents to, you know, continue to keep a level head. If we do approve this motion, your kid is sick, you know, still keep them home. I know our nurses have gone above and beyond. They've had their hands crazy full. I'm with Julie. I don't think any of us signed up to make decisions that impact people so significantly. But, you know, I just think try to be smart about it, know what you're dealing with, try to get information. If your kid's not feeling good, keep them home. Yeah, that's all I have to say.
And we're going to continue with the same mitigation strategies that we had. You know, the importance of hand hygiene, that social distancing. You know, I was asked about the elementary school cafeteria. Can we go back to tables? And we're still going to stick with the desks. I know that's an inconvenience for the custodians and it's a little bit extra time to clean, but we're really not looking to remove all variables from them. So right now we're obviously changing potentially the mask mandate. Let's see what happens over the next few weeks with this. But again, we still want kids washing their hands. We still want kids, you know, maintaining that distancing. We still want that good hand hygiene. We're still going to continue to track the data. We're still going to continue to do the things that we've done since the beginning of the pandemic to make sure that our students and our staff are safe. And should we have to pivot because of anything, then obviously we'll do so.
Anybody else with from school committee with any more questions for Dr. Vera before we enter into the consent agenda to possibly vote to rescind all mandatory mask language from the Douglas Public Schools? Do I have to vote first do we do the vote first and then the language?
That you would just, go ahead, Claude.
I just want to make sure we do it right.
I'm sorry?
So, because the consent agenda, are we looking for a motion to move the language? Or are we doing the motion first to make it optional for masks in Douglas Public Schools?
So right now the language is that we have a mask mandate in school. So what you would need to do is you would need to make the motion to rescind and remove any mask mandate language policy from all of our manuals, policies, and procedures. And by removing all of that from our policies and procedures, it would allow us to be mask optional.
Okay. Excuse me, I do have one thing. Do we want to add to the motion language too, as kind of a reminder that, you do have the the vote language in front of you. Just a reminder that even though we're doing that, maybe state at the end that masks are still at this time required for buses and health offices.
I thought that if we say no to that vote, that it automatically means that masks are optional and that we don't have to rewrite all these things in case this happens again.
So
is that true?
We have two different things. Courtney, I think federal and state policy supersede ours. So if we wanted to add that in, I don't know if do we need to add that in? Because federal and state supersede local.
Yeah, actually, that's a good point. I guess if we send out a reminder, I guess that'll be good. Yeah. I guess to Becky's point, and a few have raised that, I just have a concern about the buses particularly.
Yeah, my only concern, and it's a small concern, is if we add that in the language, then we would need another meeting. If the federal government eliminated the mask mandate on the buses, and we still have that as policy, we would then have to have another meeting to rescind that language.
Mm-hmm. Yeah, I don't know that we would be having it as policy. I guess I was thinking as just a reminder, but then again, that wouldn't be legal language, when we, so, all right. I guess we can leave it as it is.
And Julie, what was your question?
So the question was, I thought the understanding was that if we do this vote, and we vote no, that we rescind all this language, so we don't have to update things and change things. And if things change and they get worse, which is very possible, that voting no means that the mask mandate in place, then it becomes mask optional.
It's the other way. No. So the way the language is written is you are voting to rescind and remove all language from the Douglas Public Schools requiring students to wear masks. So a vote in the affirmative would be to remove all that language. A vote in the negative would mean to keep all the language that we have making masks required within the school district.
So I think I had the same question as Julie before I reached out to you directly, Paul.
Yeah.
It's been so long that I didn't remember us passing language specifically about masking. And then the state intervened going into the school year, and the mandate's been coming from the state. So I thought once the state lifted it, that it was just lifted, but that's not the case. And Douglas Public Schools actually does have masking policy currently. So even though the state has lifted it, and correct me if I'm wrong, even though the state has lifted it, we also need to lift it from our independent policies and documents as a district.
Correct. So I believe it was in the second school committee meeting of September of 2020 that I made a presentation that we would be requiring masks, and it was a one-page document, and the school committee voted to support that document, that protocol, that students would have to wear masks in school. So we do have that written in there. So and some of the policy manuals that we have handed out and some of our COVID guides all speak to having students wear masks within the school. So just to be safe that we didn't miss anything, I think the language reads to rescind all mask mandate language from any documents, manuals, protocols, or procedures for the Douglas Public Schools effective February 28th. So it would remove all that language that we currently have. It's kind of like the school choice vote that we do, or that we will be doing in a few weeks.
Any other questions from school committee members? I'd be looking for a motion from someone.
Wait, I got one more question.
Okay, Julie, sorry.
I just wonder, based on, we have 9, well, my thing has 9 screens. I don't know how many screens are actually, mine's so small. This is going to be a weird question. No, mine has 4 screens. Is there a way to gauge interest on, to see what people that are on right now, their opinion, if everybody thinks that we should vote for it or no? We're just going to go with what we...
I mean, that's what the public speak portion is for. So
I agree, Becky. That's what the people are here for. We've left it open. Very few people spoke up about it. We have received emails to the committee, as well as Dr. Vera has received them too as well. So I think it's been published and widely known that we would be having public speak at the beginning portion of our meeting this evening.
One of the reasons why I sent out that memo about 2 weeks ago, it let the community know what what my recommendation was going to be, was that if there was an outcry one way or the other, we would receive emails. So when the commissioner, on whatever date it was 2 weeks ago, said he was going mask optional, I think between myself and the school committee, we received about 10 emails from parents, each stating, please, please, please take the masks off. When I sent out my recommendation to what my recommendation was going to be to the committee, I received one email the next day from a person that said, would I consider pushing it out 1 week until after February vacation? So that's all we've received from, that's all I received from people in terms of communication. I don't know if the school committee got an overabundance of emails one way or the other that I'm not aware of. My chat is blowing up right now.
I was just going to say, I think I got my answer from the chat.
My chat is blowing up, basically saying, I'll gladly comment on it again. Stop the mandate, same here. I'll gladly speak on it. Stop it now. Remove the masks, please. Remove them all. We support ending the mask mandate. Enough already. End the mandate and make it optional. Drop the mandate. Remove the mandate. I'll gladly state my opinion is to make masks optional. We support
in true Douglas spirit. This is true Douglas spirit. So I mean, it is what it is.
I put my blinker in.
So
I think we heard from everybody here, and thank you all for your comments. It's been a lively. We normally don't get this many people to show up for our school committee meetings, so I do appreciate everybody voicing their opinions and making sure that we hear you.
Thank you for voicing the opinions on the chat in a polite way too.
Yes,
I appreciate that.
Again, so are there any further questions or responses from the school committee for Dr. Vera or Courtney? If not,
one other thing. So if there are families that are uncomfortable with having kids go to school because they could have immunocompromised kids or whatever the case may be, I don't know. What happens next for those families that aren't comfortable with their kids being in school right now?
The families have a choice. They can send their kids to schools with masks. And then if they're still uncomfortable with that, then they can reach out to us to help us explain some different options for them. Unfortunately, there is not a remote option this year that's allowed to us. So remote isn't an option. So if families choose not to send if they feel uncomfortable sending their children to school, even with the mask on, we can help them navigate what some additional options for them could be.
Any last thoughts on any school committee members before I be looking for a motion?
Make the motion to move to rescind all mask mandate language within any documents, manuals, protocols, or procedures for the Douglas Public Schools effective February 28th, 2022. The district reserves the right to reinstate masking should the need arise.
I'd be looking for a roll call vote now.
We need a second. I'll second.
Motion made by Lisa, second by Becky. I'd be looking for a roll call vote from each individual school committee member, please.
Becky Charniak, aye.
Lisa Brown, aye.
Julie Mulder, aye.
Heather Moran, aye. Thank you. So just to be clear, that means masks now become optional except for transportation, which is our buses and the health offices where the nurses are. Again, and another email will go out again from Dr. Vera, making sure people understand Monday morning when people get on the bus, you need a mask. Thank you very much for everybody for coming tonight for this healthy conversation we've had on masks. Is Courtney, do you have anything for the school business and operations managers report tonight? Is there anything?
I know I don't this evening. Thank you.
Topics not anticipated for us. We don't have anything. Just before people start jumping off, we have 2 vacancies on school committee coming up in May for elections. So if anyone's interested, you can reach out to me if you have any questions about school committee. I'm more than happy to answer anyone's questions. We have no need for executive session this evening, but our next school committee meeting is next week on March 2nd in the school, at the high school building, back in our normal room. So if anyone would like to join us there, we would welcome you as well. I'd be looking for a motion to adjourn school committee meeting at 7:36 p.m.
So moved.
Second.
Lisa Brown made the motion. Becky seconded it. Roll call vote, please.
Lisa Brown, aye.
Charniak, aye.
Julie Mold, aye.
Heather Moore and I. Thank you all, everybody. Have a wonderful vacation.
Vacation. Stay safe, everyone. Thank you.
Thank you.